Welcome to It Can Get Better Than This. I'm Dr. Cindy Byler.
And I'm Heather Hodge.
On today's episode of Autism Through the Lifespan, we're interviewing Darby Chapman from Donovan Rehab. We've had the privilege of interviewing 3 professionals in the medical fields that specifically work with people with autism. And Darby Chapman is telling us today about the world of speech pathology and how it helps people acquire skills that they didn't have before.
Darby is an upstate New York native. She moved to Georgia at the start of COVID as she was finishing grad school. She graduated in May of 2020 with a master's in communication sciences and disorders. Darby completed her fellowship year in a private practice. She has worked in both school systems and private practices for the majority of her career. Most of her experience lies within the autism community, focusing primarily on language acquisition, sensory feeding, behavioral challenges, and implementation of AAC. Darby has always had an interest in pediatric feeding, fueled by her experiences with her own children. She earned her Certified Breastfeeding Specialist certification in June of 2025. She has also completed DTTC training to support childhood apraxia of speech, is pursuing further education in pediatric dysphagia and feeding, and is hoping to become further trained on AAC. Currently, Darby works at Donovan Rehab as a speech language pathologist. She also serves as the head clinician and a supervisor for students and clinical fellows. Darby can typically be found learning something new, spending time with her family, or traveling around the world.
Let's take a listen.
Thank you for being with us today, Darby.
Thank you so much for having me.
That's a lot of credentials. So we're going to unpack a lot of those credentials this morning.
Yay.
Yay. Okay, so let's start with what sparked your interest in speech language pathology?
So when I was going to school, I actually went in to be a pediatric oncologist.
Oh, wow.
I didn't even know what speech was. And when I got into school, I quickly realized that was not going to be for me. When I failed biology of cancer, that was not a good course for me.
That's fair.
So I was like, maybe this isn't
There
my
always
course.
seems to be a weed out course.
Yes, that was my weed out course. So it was either drop out of college or find another career, another major. So I had talked to my sister, and the school that I was at, Ithaca College, had a really, really good speech program, and my sister told me all about it. She's a high school special education teacher, so she was familiar with the field. So I started taking classes, and I was like, yeah, this is pretty cool. I like this. I applied 3 times to the program, and I got denied each time.
Wow.
Oh, wow.
But I told them, oh, well, I'm going to keep taking classes and you're going to accept me. So eventually they accepted me my sophomore year into the program. And I just loved everything about it. So I continued working with it. And, I continued on to get my master's. And once I started working in the field, I was like, oh, wait, I did this when I was younger. I actually couldn't make my R sound. Couldn't even say my name or anything. So I was in speech therapy until I was about 4th grade.
Oh, okay.
So I was like, whoa, this is really cool. I didn't realize that this was like something extra. So, and I continued on with
That's
it.
cool.
Yeah.
That's cool.
Did you enjoy it when you were a kid, like to be in the program?
From what I remember, yes.
Okay.
I vividly remember though, when I was in 3rd or 4th grade, I forgot to do my speech homework and I ended up getting restriction. So I had to sit in from recess, and that like traumatized me. I still vividly remember not being able to go out to recess that day. But besides that, I really liked it. So it was fun.
Cool. Okay.
Yeah.
So who benefits from speech pathology?
Anyone. So we can work literally across the entire lifespan, from the time they are born to the time they are, passing away. So anyone 0 to 100 can benefit from speech therapy. Most that you think of are typically kids that have speech delays or have autism or anything like that. Okay. Also, though, we can work with individuals who have had a stroke, who are in the hospital having difficulty with feeding, anything along those lines, we can work with them as well.
Oh, wow. And at Donovan Rehab, you mainly work with children with autism and other special needs?
Yes, ma'am. So we do a lot. We're a pediatric clinic, so we work, most of our clients are between the ages of 1 and 18. Okay. We can take some younger ones, just it's not as common because typically the babies are more feeding based, and there's we're limited on the resources, unfortunately, in the area, but we can if there's any communication delays, if they are struggling to make specific sounds, if they have a fluency disorder, so that stuttering that we think of, autism, Down syndrome, anything that does not present as normal communication, bring them on over to us.
Oh,
That's
wow.
cool.
Okay.
Yeah.
I thought it was just specifically autism, but it's
Nope, we can
any
do
kind
very
of special
broad.
needs.
anything. Yep.
Wow.
That's cool.
That's great.
Yes.
So how do you help children in speech pathology, especially with autism? So there's a percentage, I think 40% of them are nonverbal. So how do you go about helping somebody that is nonverbal?
So the way I like to give it, represent it to parents is think about when you learn to read, right? When you learn to read, if I give you this, you're going to turn it like a normal book, right?
Right.
You need to learn how to turn the page. You need to learn that these words mean something. I can't expect a kid to talk if they don't know the rules of communication. I need to teach them how to play, how to make eye contact, because when we talk, we look at each other.
Oh, wow.
We're gonna learn turn taking. And for little kids, that looks like sharing, and it looks like a lot of parents, oh, I can do this at home. But there is a way to teach them how to appropriately take turns during conversation, how to ask for something versus just taking something, right?
Mm-hmm.
A lot of kiddos come in that have autism, and the parents say, oh, they just take my hand and show me what they want. I love that. That is wonderful that they know what they want, but we need them to ask for it, right? They're not supposed to just take it. They're not supposed to have you just take it and give it to them. We want them to ask, whether it's signing for more, or they want to eat, they want to drink. We can teach them different colors. So if a kiddo is nonverbal and isn't showing any signs of wanting to talk, we can do AAC, which is something I love. So there's lots of different AAC that we can do. We might teach them just to imitate a cow, right? We're going to say moo for 30 minutes. It's great. That is such a great success. If I can get a kid that has not said anything and he comes in and he says moo for 30 minutes, I'm putting that down on my resume. Like that is great. I love that.
Because he has said a word.
He said, yes, he said a word. He said a sound. A lot of kiddos will come in and they just go, E. That's success. That is a sound. That is one of those milestones that we really want to see when we're looking at little kiddos. We talk about cooing, we talk about babbling. Some kiddos, if they're 5 but they're babbling, hey, they're meeting some milestones. That's all I care about.
Mm-hmm.
So there's a wide, I could stay here for hours and talk about what I could do with kiddos with autism.
Well, tell us more.
So like I said, AAC, I want to talk a little bit about that because I think that is one of the most important parts about working with kiddos with autism, specifically when we have kids that are nonverbal. AAC stands for Alternative and Augmentative Communication.
Okay.
AAC for short, because that is a mouthful. Typically what people think of when I say AAC is a device. That is AAC, absolutely. This can be AAC.
That's what I've heard is the device.
Yes.
Is what it's called, or the tablet.
Yes, exactly. But that's not the only AAC. So AAC is anything that supports your communication. So I actually have a little activity if you guys want to try it.
Yeah.
Okay.
Oh, cool.
So this book is something that you guys are, 2 smart adults. I feel like you can read this, right? It's a kiddo book. So I'm going to have you guys read it. I'm going to have you guys read it. This one is the easy one. Then this is the AAC one, but I'm going to have you read that one first.
Okay. You can do that,
Okay.
Heather.
So this is what it looks like. It says my favorite bug.
Yay, she read it.
Good job.
Oh, okay. Yeah. So can you read that? Here.
That would be
I
funny
bet some
if
of
we
you
could.
can read this. We cannot. Okay.
I bet my cousin could read that or that.
Can you read this? I can't read this. They didn't even offer this at my high school. Can you read this?
No. Is this all the same language, or
It
are
is
these
the same
different
language.
languages? Oh, funny.
Do you guys even know what language that is?
I can't even
Is that
recognize
Mandarin?
it. Wow.
It's not. It is Cantonese.
Oh,
Oh,
yeah,
okay.
no. I have no idea.
Thanks to Google Translate.
And I still feel the need to see all the pages. I'm sorry. There we go.
No, so that was really hard for you.
Yeah.
Right? You could not read anything.
I don't know
of it.
anybody's favorite bug in this book.
No. So when you bring a kiddo into me that, you say is nonverbal and, make them talk. That's what you're saying to them. You are giving them a book that isn't Cantonese.
Okay.
Right? They have no idea what you are asking them to do. Here's your AAC.
Okay. So again, it says my favorite bug. Oh, okay. So here you see too. Sorry. So they have the Cantonese here, and then we have pictures. It says I love, probably heart love, ladybug.
Nice job.
Okay.
Yes.
They are red and black. Oh, I'm going to have so much fun with this. I feel so smart right now. They smell with their feet. Oh, cool. Okay.
Is that they smell with their feet?
Oh, sorry.
Oh, ladybugs smell with their
yes,
feet.
ladybugs smell with their
Oh,
feet.
okay. Like I don't smell with my
Like,
feet.
look at that. Tell me I'm telling you I'm
Right.
wrong.
No,
I'm telling
you're
you.
right.
They are also four-leaf clovers. I don't know.
Lucky.
Oh, lucky.
lucky.
They're also lucky. Ladybugs are my favorite bug. Oh, cool. Okay. You see?
Oh, cool.
So now that you just read Cantonese, how do you feel?
Like really smart. I got those picture graphics too.
Yes. So that's what AAC does for kiddos. That was
Okay.
AAC. That is a perfect example of AAC. So obviously I want to give a child a book in Cantonese to read if they have autism and are nonverbal. But that's exactly what it can do for them. So it can really support them with their communication. So we use a lot of times we do use a device to support them, but it can be pictures. You might have heard PECS, Picture Exchange Communication System. So that is we are taking pictures of things and they're expected to hand you the picture of what they want. So we can do it that way. We can do a choice board where it's just a piece of paper and you can point to what you want. Nice. We can learn sign language. So that is a lot of times the first thing I will do with kiddos is teach them more, eat, please, thank you, those simple what we call baby
Basic
signs.
Yeah.
Yes. I taught them to my own children just because I was like, I need you guys to tell me what you need. Because it's really important. So we do that so that they have a way to communicate, because sometimes expecting them to talk is just, it's too much on their brain. It's way too much. So we're going to give them, and the words are kind of abstract, right? There's no meaning until you know the meaning. But this has a visual representation of that word. So if I say more and I'm also signing more, okay, now they're seeing it. They're kind of getting a full sensory integration of it. Okay. So, we have kiddos that respond really, really well to sign language. And then we have the lovely device. So there's lots that we can do on a device. This is one of the apps. I'll show you camera and then you guys as well.
Cool. Okay.
So an app like this, we could say, for example, I want, there's a voice. So I can make a sentence, I want orange ball. And a kiddo can come in and tell me, I want the orange ball that you have, right?
So let's show this up to the camera so people can see it.
So again, I'm going to clear it out. We would say, I want orange ball. And then we could speak it, and it gives us that whole sentence.
So this is before they can even read as well.
Because they don't need to read. They just have those pictures.
Right.
So a lot of times what I do when I'm getting a kiddo ready for AAC is I'm working on picture identification. So we're playing picture bingo, and I'm going to have them match those pictures.
Before they get the device.
Yes.
Okay.
So getting a device is a process. It takes several months. It's not, oh, we're enrolled in speech therapy, we're getting a device. There is a whole process. I need to ensure that the child is ready for a device, because not everyone can benefit from AAC, but not everyone succeeds with AAC. Okay. Right. So some kiddos, it becomes more of an issue than not, because all they see is an iPad. They want to play on the iPad.
Right. Games.
Yes. So sometimes we see those behaviors escalate because they can't get out of the speech app. Right. I'm mean, and I turn on guided access, so they have no access to all the fun stuff. They only have access to the speech app.
Smart.
Yeah. Okay. And when you get a communication device, specifically if you get one funded through insurance, typically the only thing on there is that speech app. Yeah. For a reason, right? It's supposed to be your communication device, not a toy. And this isn't the only app. There are plenty of other apps. There are some that are more motor based. So the kiddo doesn't even have to remember the picture. He just has to remember that motor memory. And that becomes more natural the more frequent that he does it.
Can you explain that a little bit more? What do you mean without the pictures?
So, and I'll show that one. So for example, this one, these words are kind of, the pictures don't make any sense. The buttons, the words, all of that. This is an easy one, but these buttons never move. So
Okay.
like we saw on this one, it moves around. We can press all these buttons, right? There's a bunch of
Okay.
stuff. On this one, every time I press that, it's going to stay there. These buttons are not moving. So the kid remembers that motor, that sequence of
Okay.
I always am going to touch here if I want more. We could add in the colors. So he knows every single time where red is going to be. He just has to remember how to get there versus remembering what that picture is, what that word is. This one is a little bit different because it's all about motor sequence.
That makes sense. Okay.
So and that's part of the reason why it takes so long to get a device, because I need to figure out what is going to work best for this child. Is this child matching the pictures? Is this child still at a very basic level and we need to just do a motor sequence, because this motor memory comes a lot more natural than other things do. It's a lot less teaching because it's just a same thing every single time.
Right.
Versus having to navigate so much.
That's cool. And you just add more words and pictures as the child learns more.
Yep. So for example, if I wanted to add, let's say my child has learned the colors now, I'm going to add in, I'm just going to do one for quick, but we're done. So now I have my colors in there. So now I can, we would fill it up with the colors and I can start requesting the colors that I want.
That's cool.
So there is a lot of different things we can do with AAC. There's some apps that are even more basic than this if that's what a kiddo needs. What's also really cool is we can get these apps for kiddos that are completely paralyzed, or maybe don't have the ability to touch a screen.
But they could do eye tracking.
Yes,
That's
we
cool.
can do eye tracking.
Oh, wow.
We can do it for where literally the device sits up like this and it just tracks where your eyes are going.
Wow.
It's really cool.
That is really cool.
That's why I'm so interested in it. We can also do things called switches, and where, if a kiddo is in a wheelchair, all they have to do is hit a button and it will navigate what they want. They don't have to actually touch the screen.
Wow.
So lots of different things we can do with AAC, and that's why it takes so long, right?
Yeah.
Because I need to make sure they are expensive, very expensive. So I don't want to get the wrong thing.
Right.
Typically we can make a case for insurance to cover it if needed. But I need to make sure that insurance is paying for what you need, because they only pay for one every so often.
Okay.
Gotcha.
So it's a process. But for more kids than not, it's worth it. It's beneficial. And what's really important is that AAC does not replace necessarily spoken language. I have some kiddos that come in, they're nonverbal. I'm like, all right, let's get a device. And then they end up using the device to just model their sentences, and then they repeat the sentence. So they are now...
Nice. So it's teaching them how to speak, not replacing speech.
Correct. Because they are, instead of me sitting here and saying, tell me more, they're going on here, they're choosing what to say, and then they're just imitating it verbally. And kiddos respond a lot better to that, because I'm not placing any demand on them to do that.
It's more autonomous.
Exactly.
Yeah. Oh,
And it's really nice because we can personalize it. We have lots of kiddos that, if the family's really involved in church, they will program some prayers that they want to add in there. We take pictures of all the families in there. The first button I always add for the mamas is "I love you, mom." So that I'll end the session and the kid will go out and say "I love you, mom." So I've had lots of tears.
Yeah.
But
you do that on purpose, don't you?
I do. That's totally on purpose. But it's very versatile and very personable. So we can do whatever we want to really make sure that the kiddos are benefiting it, and it is for them, not for the world.
Right. That's really cool.
Yeah.
Do you have more questions about the device?
No, I don't think so. That's really, you have an idea when you see kids around with it, but to really know the in-depth details of it is really interesting. It's really cool.
Yeah. We have now a young man, because he's a teenager, who started, he's in our church and within our family tribe, and he started out nonverbal.
Mm-hmm.
And I remember him getting the device, and the level of speech, understanding what he was trying to say beyond the grunts, was phenomenal. And then he started picking up more language. I was worried it was going to replace instead, just like people worry about sign language.
Yes.
And so now it's not always clear, but it's getting clearer and clearer, I would say.
Very
and
cool.
his speech is really taking off. So
And that's what I love about AAC is if the desire is to replace spoken language, we can do that, but it doesn't have to. It all depends how you are using the device and how you're using any AAC, whether it's sign language, pictures, or a device. My first few sessions, whenever a kiddo gets the device, are targeted at the parents. I make the parents sit in on these sessions, and we are doing 2-3 sessions of parent training because while my job is important, there's a reason that I'm in this field. It's very important. I see your kid for 30 minutes.
Right.
I'm going to give you the tools. It's up to you to implement them.
Right.
So I'm very adamant about the parent being involved with the device so that they can model how to use it. I tell the parents the first time they get that device, I say, take it home and explore it. I want you to use it. Delete everything if you need to. I'll get it back. I don't mind. Like, I want you to explore it, and I want you to be comfortable with it because, well, yes, it's for your child. You need to know how to use it because I say this, some of these kids are geniuses with these and they know how to navigate it more than I do. But more often than not, they're going to need support with it.
Yeah. Right.
And I want to make sure that the parents are comfortable with it. So, and know how to use it and what our goals with it are. So are we using it as our full language? Are we using it to support our language? Are we using it just as needed if the child can't think of what they want to say? Like why are we using it? What are our end goals? And we're going to work as a team to make sure we meet them.
Are some parents resistant to the AAC device?
There are definitely some parents that don't want AAC, and I'm going to respect that. I'm not going to force a device on some kiddos. Some parents are we're not having any electronics in our house. That is your right as a parent.
Okay.
I'm not here to change your parenting styles. I'm going to give you my recommendation, and if you don't want it, that's fine. It's not my child. Right. I would be upset if someone came in and told me how to parent my child. I'm not going to tell you how to parent your child. With that being said, it doesn't always get received well, but I'm very real with my parents. Like, hey, I don't think your child is going to be able to sit here and have a conversation. I think a device will benefit them more. If you don't want that, that's fine, but understand where I think he's going to go.
Right.
Most parents are pretty receptive to that. They like the realness that I give them. Because, I think there's some rose-colored glasses going on. So I try to be very real. And, I'm not mean. I don't be mean to people, but I be real with them because I think that's really important that, I'm not coddling you. I'm here to help you. There's a difference.
Right.
Yeah. So what is the difference between a device like this and using sign language?
It all depends on the kid. So sign language, it can be a full language. As we know, individuals that are deaf or in the deaf community, they use sign language fluently. It is a full language. But some kids don't have the cognitive ability to be able to combine all these signs. They don't have the cognitive ability to understand, I want more oranges, right? I would love for them to be able to do that, but some of the kiddos, they're just going to catch more orange, right? Which is fine. I love that. They got their point across.
They're still communicating, right?
Yes. The other issue is, especially when we're looking at schools and things like that, not everyone knows sign language.
Yeah.
So if you're not in a community that understands sign language,
you're still prohibited. Yeah.
Exactly. The other thing I really like about devices is we can change the language. So, especially here in Liberty County, we have a lot of people that speak Spanish or, different languages.
Right.
I can switch this to be all in Spanish. I can switch this to be English and Spanish. So when a kiddo is going to school, if they speak Spanish at home, but they're immersed into an English classroom, we can switch back and forth.
That's cool.
And what's nice is the buttons don't change. So the buttons are exactly the same,
right?
Just the word changes from English to Spanish. So if the kid just knows what the button is, like that motor-based one that I was showing you guys, he doesn't need to know what it says. He just
Right.
needs to know where the button is, and then the person listening will
Will
either be in English or
understand.
Spanish. Yeah.
Okay.
So they'll understand it. So that's another benefit is the versatility with the devices is I can change my languages. Everyone's going to understand it because it literally says the word as if I was talking.
Right. And they're
Oh,
getting
that's
their
cool.
needs met a lot easier than otherwise.
Yes.
Okay, cool.
Yeah, that
Yes.
makes a lot of sense.
Yeah.
So at what age would they start with a device?
Again, it depends on the child. I've had kiddos as young as 2 come in. I've had kiddos that are 8, 9, and they're still not ready for a device.
Okay.
A lot of things play into it. So some of those prerequisite skills that I was talking about, being able to understand that I need to ask for something, that's really important. Being able to match those pictures. So it's kind of up to however the kid is progressing with
Okay.
their goals. Behaviors are a big part of, determining that. I've had kiddos that very, very aggressive, rough behaviors. I pull out my clinic device. We use it. They do really good. I'm like, okay, maybe this makes sense. Like, this is calming you down. We get a device. I have one kiddo, we got a device, and behaviors have been a complete, like,
Wow.
got
Is it
out of ABA
Right.
behaviors. Great.
Is it
because of
because
device.
they're finally being understood? I know that's we have a 2-year-old, and I'm finding that a good portion of our battles are when we can't quite understand what she's saying.
Yes.
And that makes sense, though.
I
I would
mean,
get frustrated if
I was
no
gonna
one
say,
could
like,
understand
I
what
think
I'm
about
saying.
if I'm mad and I try to explain why I'm mad, but I can't get it out.
Yeah.
It just makes me more mad.
Right.
I'm angry, right? So it makes sense. Behaviors are communication. That is their way of communicating because they don't know how to otherwise, and it's just making them more and more mad. So when they get a device, if the behavior significantly reduced, it's
Wow.
likely because, okay, I'm being understood. I can get my wants. I can get my
Right.
needs. Like, I don't have to, if a kid is potty trained and they don't know how to tell you they need to go to the bathroom and then they're soiling themselves, now they have the device and they say, potty, 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 potty. We're running to that
Right.
bathroom as fast as we can.
Yeah.
So, that plays into it a lot.
Wow. Well, so it can be life-changing, not just for the child, but for the parent as well.
whole
And
family.
Absolutely.
then family.
Yes, it can. And it's life-changing for me, if I'm being honest. Like, I have some kiddos that I've gotten the device for, and I'm just like, it makes me tear up sometimes with the parents. I'm like, yeah, we're just going to cry right now because this is wonderful. Because it's life-changing, like you said, for the child. It's life-changing for the parent, and it makes me feel like I've helped them, and my job is worth that very expensive piece of paper that I got.
Right,
two pieces of paper. You were saying earlier, I have a slew of certifications. They don't mean nothing if they're not doing anything.
Right.
So it's life-changing for me as well that, when I see a kid succeed as much as a lot of them do with these devices.
That's cool. That's really awesome.
Yeah.
So one of the words in your biography was child apraxia.
Yes.
Am I saying that right?
Yes, you are.
Can you explain what childhood apraxia of speech is?
Yes, I can. So, for example, if I said, pick up your paper. Wonderful. You did it. Great job. Child with apraxia, if I say pick up your paper, not speech, you can have apraxia in any of your muscles.
Okay.
So if I say pick up your paper, right?
Gotcha.
That's what apraxia
They
is.
can't do it.
Their muscles and their brain are not communicating.
Okay.
So there is a miscommunication in that processing. Specifically when it comes to speech, it's with your oral muscles.
Oh.
So you have a whole bunch of muscles. I don't even know the names of them. Don't quiz me on that. You have a bunch of muscles in your mouth.
I bet you took a test on this
I
once.
did.
then.
I did. I don't think I did very well on that. But so yeah, we have a bunch of muscles. We have a bunch of nerves in our mouth, and our throat and all this area. If your brain is not communicating correctly with those muscles, we have a lot of things what called groping. So for example, if I'm asking a kid to make an S sound, right? S is S, but they might go.
Okay.
Right, they're struggling to figure out how they know how to make it. They can tell you how they're going to make it.
Yeah.
Their brain is not letting them. So there's a miscommunication between the brain and those muscles. So kiddos with a childhood apraxia of speech, they don't benefit from typical articulation therapy where we're coming in, I'm saying, hey, put your tongue behind your teeth and blow out the air and make your S sound. No, that's not going to work for them.
The brain's not going to communicate with the mouth correctly. Okay.
Exactly. So for them, I might have to literally put on my gloves and close their mouth, close their teeth, and make sure that tongue is not on there. So it's a lot more hands-on. It's a lot more tactile. It's a lot more drill. I have the DTTC training. That's a level of cueing. And then there's another training called prompt I would love to do. But that's about how you're cueing them. So the tactile cueing, there's different, I don't know them, but a modified one that I do, if we're trying to make M, we're going to actually touch our mouth, so that they are getting a whole bunch of input on how to make that M sound. And then for the DTTC, you're going to say the word with me. You're going to hear how I'm saying it. We're going to practice it together. And then we're going to move on to, you're going to imitate it. And then we're going to move on to delayed imitation. And then we're going to move on to multisyllabic words. And there's like a whole hierarchy of how we would teach that child to make it. But it's important to know when a child does have apraxia, because like I said, they don't benefit from the same type of treatment.
Right.
So it has to be adjusted a little bit.
Is that diagnosed by a pediatrician first? Or?
That would be diagnosed by us.
Okay.
So when a kid comes in, typically apraxia looks like an articulation delay, which articulation is how you make your different sounds. So if a kiddo comes in and mom's like, yeah, it's really hard to understand him. I don't know what he's saying. I'm going to do an articulation test on him. I'm going to see what sounds he does have, what sounds he doesn't have. Typically with apraxia, like I said, we have that groping where there's a lot of extra movement in the mouth, like they're trying to figure out
it.
Yeah, they're trying to communicate how to make that. A lot of times kiddos with apraxia also struggle with non-speech movements. So stick out your tongue. Kid might go, not know how to stick it out. Puff up your cheeks. So we do what's called an oral motor exam, or an oral mechanism exam. I'm looking at all the functions of your mouth to see, does everything structurally look correct? Is that what's impacting it? If a kiddo has a tongue tie or something, that makes sense that you can't make a K or a G because your tongue can't move back to make that sound. Or is there no structural difficulties, but you're having a motor difficulty? That would fall under childhood apraxia. There's other motor speech delays, but I would start suspecting apraxia, and then there's a whole bunch of other ones that is it this one or is it this one?
Right.
So it takes some time. Apraxia is one of those nothing else makes sense type things.
So it could get it could take a little time to get to the root of it. Okay.
I've had some kiddos that it's taken me several months to get to the apraxia diagnosis.
Oh, wow.
Because I want to make sure that I'm accurate with my diagnosis of that. And that I'm going to treat it appropriately. Because there's, different ways to, like I said, there's different ways to work on that. So yeah, we can diagnose it as speech language pathologists. That falls within our scope. If there was apraxia of other limbs, that's someone else's.
Right. That's not speech pathology anymore.
Right. I just deal with this part.
Right.
Yes. So.
Oh, that's cool. They can also use the devices.
Yes.
To work on that.
So if we have a severe case of apraxia, for a quick fix, a device might help. They also would have that to model those words, those sounds. A lot of kiddos with apraxia have trouble with vowels too, though. So it's not just the consonants that we're struggling with, it's some of the vowels. So vowels are in every single word. Sometimes it's the only thing in a word. So if they can't even make those, then a device is definitely beneficial because it's going to take us a minute if we're still working on the vowels. So we can use a device for, you don't have to have autism. You don't have to have a developmental delay. You can have just a really severe apraxia or articulation delay. And we can use that device.
Wow. That's cool. Are there other devices or tools that you use in therapy?
Yeah. So we use, one of my favorite tools to use is a lollipop.
Oh,
A lollipop is a lollipop in a straw. Kids love me because I always encourage the parents to go get Capri Suns,
Okay.
or any juice boxes with the skinny straws, coffee stirrers, anything like that. I use a lot of those. We use lollipops are great to push that tongue back and get that
Oh.
K and that G sound.
Okay.
So there's different parts of your mouth that certain sounds are made. So we use a lot to move that tongue where I don't have to actually hold your tongue and put it.
Yeah.
Kids don't typically like that. I've been bit way too many times. So I try to use other things that will
wear padded gloves.
Yes. We have like some flavored tongue depressors, the wooden stick.
Oh, that's cool.
They taste like a strawberry, so that's pretty cool. We can use like a vibrating toothbrush. That's actually really great for muscle stimulation. Specifically for those kiddos that have apraxia and things like that. I'm trying to wake up those muscles and teach them. So we have lots of fun tools.
That's cool. Melissa
Yes.
brought some toys in when she was here with us, and we enjoyed those toys.
Yes. Play therapy are super fun. Anything can be a speech tool. I had parents like, what toys can we buy? Go to the dollar store, buy construction paper and some pom-poms. There's your speech therapy session. Like you
great.
can do so much with dollar
Right.
store stuff. So
Yeah, so it doesn't have to cost a lot of money to even try to do this stuff at home.
no, not at all. And a lot of times you can use stuff that's already in the community. One of the tasks that I always give parents is go to the grocery store. You're going to ask them WH questions. What fruit does a monkey like to eat? What are we going to get? Oh, we need bananas. For higher level kiddos, I really want to have cereal tomorrow morning. What do we need to get? Right, I need to get my cereal and my milk. Let's make brownies tonight. What ingredients do we need? Right, so we can work on a lot of those different things, just without buying anything.
Right,
So
right. And speech affects every area of our lives. So you can do this in any setting, really, so that it continues to build their speech and their use of speech.
absolutely, it's every aspect of our life, and speech actually has, there's 9 domains to speech. There's 9 areas that we can work on. We got receptive, expressive language. So receptive is what you're understanding. Expressive is what you're communicating out. We have feeding and swallowing. We have pragmatics, which is that social communication. We have articulation. We have voice. We can even do, if we get to the point that someone is really high pitched and they want to have a lower pitched voice, we can do that. We can, the motor speech. So that would be like that apraxia, dysarthria, those types of things. Cognition. So like I was saying earlier, someone that has had a stroke that might be in a hospital or a nursing home, we're going to work on getting back to doing their checkbook. Right.
wow.
That is a thing that we can work on as well.
That's
wow.
cool.
So literally every aspect of your life.
Yeah. And even affects your feeding. So if a child is having a struggle eating, that is something a speech pathologist can work on as well.
Yes,
Oh,
ma'am. So,
wow.
and that's what actually sparked my interest in the lactation. When I was in grad school, I took a class in pediatric feeding, and I was like, wow, this is really cool. But South Georgia doesn't have a whole lot of resources for that. And then I had my own 2 kids, so I was like, okay, like I really want to explore more on this. So I did the lactation, and now I'm doing the program for pediatric dysphagia. And we can absolutely work on that. So whether it's a kid that is struggling in the NICU to latch onto a breast or a bottle, a kiddo with autism that doesn't like certain textures, we can work on all of that.
Oh,
That's
okay.
really cool. I didn't know that you could that there were things that you could do to work on things with texture. That's cool.
Yeah. So we, I had a kiddo that I used to work with that didn't like the sound of him chewing. He literally did not like, cause
His own chewing.
He did not like it.
Yeah, there's a word for that.
I don't know the word.
No. I was like, I know that's a common thing I've heard bore is
Yeah.
the like distaste that people have for that sound.
Oh, funny.
Yes. And don't get me wrong, there's some things I'm like,
Yeah.
I don't know about that. But yeah, so if a kiddo is not eating because of these sensory difficulties, parents will come in and say, oh, he only likes to eat goldfish. Because if you think about it, goldfish, it is the same thing every single time you eat it.
Right.
You go to eat a blueberry, one might be crunchy, one might be squishy, and that freaks me out. So, I would definitely expect
Peace for me.
Yeah. So we can definitely support kiddos with that as well.
Okay. Wow.
So when you go in, like as a new parent or a caregiver and you have a child, they give you tests for milestones with autism, and they tell you we're looking for these milestones to be reached. And that's kind of where a lot of people start. What are some things that we could look for that we would go, I think my kid would really benefit from a speech pathologist?
So there's lots of things to look for. So babbling and cooing around when they're infants, those are really important. If you're not noticing that, bring them in. A first word usually appears around 12 to 15 months. If you're getting to the 15 month and they're still only cooing, bring them in.
Okay.
A lot of times with autism, we see kids that are talking and then for whatever reason around 2 years old, they stop.
Yeah.
Bring them in. The other thing I like to give as a rule of thumb for parents to remember is their age is how many words they should be combining. So at 1, I want 1 word. At 2, I want 2 words. More please, more juice, things like that. Where's daddy? 3 words, and so forth. And by 5, I expect full sentences. There's unfortunately, the milestones are all over the place.
Yeah.
They're constantly changing on what the expectations are. Since COVID, they've actually redone them because there was such a discrepancy going on because of COVID. Kids weren't getting out. So all those social communication things were happening. Sicknesses were impacting a lot of kiddos. So a lot of the milestones have actually been pushed to later. So I'm not gonna say I remember them off the top of my head. I still go by what I'm expecting, what the tests are saying. But if it never hurts to get evaluated. If you feel like this doesn't seem right, trust your gut, bring them in. Worst case, I'm like, hey, your child's perfect.
Yeah.
See you later. Like, it never hurts to hear that your child's perfect.
Right.
So, if you need to, like, I highly suggest just bring them in and be like, I just want to make sure we're where we need to be.
Yeah.
Do most people need an autism diagnosis for their child to have speech language pathology covered?
Absolutely not.
Okay.
A lot of times kiddos come in before they even get the autism diagnosis, and I'm like, hey, I'm seeing some red flags. If you're comfortable with it, maybe go get checked out. On the flip side, typically the first place that you're going to get sent once you get that autism diagnosis is speech.
Yeah.
Because autism is a social communication disorder, and that literally is one of the things that we work on. So it goes hand in hand a lot, but you absolutely do not need to have an autism diagnosis to come
excellent.
in. Anyone could come in for speech.
And insurance will pay for it even if without the diagnosis.
Correct.
Okay.
What is important for insurance to cover it is that your scores are falling within a mild or more delayed range.
Okay.
So unfortunately, we have to give standardized tests, and there's specific scores that we end up getting standardized scores, and they have to fall below a specific range for insurance to cover it. Now, ethically as well, if a child comes in, typically, a lot of our scores are 85 to 115 is considered average for most tests. So insurance is looking for an 84 or lower.
Okay.
If I have a child that comes in and is at an 86 and the insurance is like, nope, not paying for it, but the parents are very adamant, I'll talk to them about it, be like, your child is average, give them what I'm expecting, their prognosis. And if I think that the child would benefit and they are willing to pay out of pocket, they could do that as well. A lot of times I'll even try to make a case for insurance. Like, yes, their score was an 86, but if we look at in 2 months when they're turning 4, their score drops to a 78. And that's a, mild to moderate range.
Right.
So I really want to ensure that there isn't a delay and there isn't a gap that's going to occur. And sometimes insurance is like, yeah, that makes sense. Okay. So it's all case by case.
Right.
Yeah. That's really cool. Okay.
So are there things that we don't know about services offered by an SLP? I think we heard some of them already.
Yeah, there's, let me think. So the feeding, a lot of parents don't realize that we do that.
Right.
There's so much we can do with feeding. And like I said, the pragmatics is a big one. Parents don't realize that, like, Depending on the setting. So we can work in a lot of different settings. We can work in schools. We can work in nursing homes. We can work in hospitals. We work in private practice like Donovan Rehab. You can work as an independent contractor where I'm going to people's houses to see them. We can work with the Babies Can't Wait program in Georgia. You can work on base as an SLP. You can work across so many settings.
Wow.
Virtual SLPs are a big thing as well. So that's kind of cool that we pop up everywhere.
Yeah, so versatile too. The field is so versatile.
Yes,
right.
You can't get rid of us. We're here.
We're essential.
Yes, we are. But what's really unfortunate is we're so scarce. Like there are not a lot of SLPs. So if you go anywhere, they're like, yeah, we're in a big shortage right now.
Wow. So this is a field for high schoolers to start looking at.
Yes, absolutely. We always welcome students to come observe. I love having college students come and talk to me about it. And there's a lot of the schools, unfortunately, especially in rural areas like where we're at, they don't have SLPs that are working in the school. So they end up getting someone that lives in Texas and is doing it via the computer. When I used to work in the schools, there was a virtual SLP that lived in Italy.
Oh,
and they were Zooming in to see the students.
Wow.
So we're all over the world, which is really cool. But there's such a shortage. So we really need more people.
Does that require a master's degree?
It does.
Okay.
It does require a master's degree. You can, if you get a bachelor's degree in the program, you can become an SLPA, which is like an assistant. But a lot of people are hesitant to get assistance because it still requires an SLP to supervise, and then a lot of insurances aren't receptive to
so it's
assistance.
better just to get the master's degree.
It's better just to go on. Plus your student loans get deferred.
Okay.
Yes,
So
that's true because you're still in school.
Yep.
Right.
So you might as well go for the master's. But it's a lot of schooling. It's a lot of hard work, but it is absolutely worth it.
Right. So that's a field that people need to look at.
More people need to look into that.
Right.
Absolutely.
So you pursued certification in becoming a lactation consultant.
Yes.
And I was researching that ahead of time to ask questions. I'm like, how does that fit? So why did you pursue the certification?
So, like I said, I was interested in the pediatric feeding aspect of it and all of that. And I breastfed both of my children. My 2-year-old is still hanging on. So we, with my son, I struggled a little bit personally with it. It was the worst thing I have ever done in my life. It hurt so bad. And I'm someone that is prideful. So I refused to ask for help. So I said, I'll just get certified myself and help myself. So that's really what sparked it. And then, because, I was interested in it. And my sister also, our kids are all close in age. So she was, talking to a lactation consultant. She was like, you should really, because she's not as prideful as I am. She's not as afraid to ask for help. Go her. But she was like, it would be really cool. And there's a lot of overlap between lactation and speech because of that feeding aspect.
Okay.
So I went in already having a basic knowledge of it, both from my personal experience and my education. And then I started, I was taking the course, and I was like, wow, I really like this. So I'm working towards getting there's a few different certification levels. So I have my initial certification, which is that certified breastfeeding specialist. There's different ones like core lactation consultant, and there's a bunch of different terms. And then there's the IBCLC, which is what you typically think of if you're at a hospital or something like that. That requires a whole lot of clinical hours and things like that. So I'm working towards that. Again, it's just resources are scarce here.
Right,
so
right.
kind of taking it as I get it. You have like 5 years to get it. So I am working towards that, but it was mostly my own experience and my pride.
So how do they overlap? Because I saw that there's programs that you have an SLP, you can also be this.
Mm-hmm.
Like, how do they overlap or correlate?
So with the feeding aspect, that's mostly where that will overlap with the speech when it comes to baby, that is. I'll get to mom in a minute. So baby, when it comes to baby, I'm looking for oral tether tissues, so oral tongue ties, lip ties, weakened muscles in the mouth, that suck, swallow, breathe. That's really, really important when they're babies. Some babies don't have that. That's where an SLP steps in to teach them that suck, swallow, breathe. It's really hard to teach, but it takes time. But we would work on that. We would work on in different types of liquids. So with a lot of kiddos will get a feeding tube when they're in the NICU. So we're working on getting them to take the bottle, because a lot of times that's the requirement for them to go home, is they have to be able to take so much of a bottle. Or, be able to latch onto the breast or anything like that. When it comes to lactation, if the child has a tongue tie, if they have a lip tie, anything that it is painful, that's where you get a lot of the injuries that happen to mothers. Is because there's something going on with the mouth. The baby isn't latching right. So that's where lactation consultants step in. And it's nice because as a speech therapist, I'm helping with that, but then I'm also helping with all this extra stuff. So if for whatever reason breastfeeding wasn't an option, but we're going to do express milk in a bottle, or even formula if that's your choice, we're going to differentiate the thickness of the liquid. Okay. Right. So we're going to add in some thickener to make sure that baby isn't choking. That's the last thing we want. Right. And as they get better, we make the liquids more thin, and then so that's the speech side of it. Right. So there's a lot of overlap with it.
Having flashbacks to breastfeeding my daughter.
But what's also nice is, like I said, so breastfeeding or lactation as a whole is a dyad, right? You can't have one without the other. Baby and mom, they go together. Yeah. There's a reason that is lactation. So the experience I have with autism is really beneficial because moms can have autism, right? Just because you have autism does not mean you can't be a mom.
Or sensory needs or sensory issues.
Any sensory issues.
Right.
I personally had to come up with some of this stuff because I was like, I cannot stand this, right? Yeah. So there's a lot of things that we can support mom with as far as breastfeeding, if that is her goal, to ensure that she's meeting her goal. So we can implement different types of, there's different guards that you can use. There's different pumps that you can use, specific types of clothing. There's that letdown. If you've breastfed, the letdown is there, and it tingles. But if for moms that have sensory difficulties or autism or anything like that,
it's a nightmare.
It's a nightmare. It is a total nightmare. So we're gonna help them through that. Cool. A lot of times it's a lot about advocacy. Some, and me included, some moms do not like the cover, the nursing cover. Yeah. If you want your baby to eat, you are going to breastfeed wherever you want to breastfeed. Someone has a problem with it. If I'm in that restaurant with you, I will be sure to say something.
Or walking through the aisle in Walmart.
Yeah, listen, I can't tell you the number of times I went over to the pharmacy at Sam's and I sat down and I breastfed my children because my children were hungry. Yeah, I don't want to watch you eat a hamburger if you don't want to watch my child eat. Like, sorry. So advocacy is a huge part of both speech and lactation. So I love people telling people about themselves. So I think it's a good field for me in a nice way.
A good field for me.
It's a good overlap for me because I love advocating for people. That is like my big thing. So it's fun.
And that works well for you in your field with people with autism, because even the moms and dads of children with autism have a difficulty advocating for themselves. Yes. It's a little easier to advocate for your child. That can be difficult, but to advocate for what you need or how you're doing something that's being criticized. It's very nice to have a support person that says, oh yes, she is right.
Yes. And a lot of moms with autism, they might not understand how to communicate that. So I might give them some AAC, be like, I'm breastfeeding, get away from me. right?
Nice.
I'll make a sign for them that says that.
I wish I had a
or-
shirt that has.
I have a shirt that says drive-through.
That's hilarious.
So like, don't try me when it comes to advocating for my moms and my babies and any of my patients. But a lot of moms with autism as well, or sensory needs, might experience what's called DMER. So that is that dysphoria that happens sometimes during that letdown. You have 30 seconds of like dread.
Yeah.
What is happening? And it happens to any, it's not just with autism, but a mom that struggles already to communicate might not know how to express that. Right. So I'm going to help her figure out how she's going to express that and how we're going to overcome it. It also plays a lot into that postpartum depression and postpartum anxiety. For a lot of moms, if they can't breastfeed, that makes it worse. Then you throw in all these other things and they are really going to struggle with that postpartum depression, with that postpartum anxiety. So I'm going to do, I'm not a licensed therapist, but I'm going to do what I can to support that person to make sure all of that is lessened. So I'm just here to help.
And sometimes finding some of the root issues as to what's causing the anxiety or what's causing the depression is better than medication, is better than a therapist can do, because you're solving the issue, the core issue, rather than just, you'll feel better or here's some medicine. And
honestly, a lot of times what a mom needs is a friend.
Yes.
And you can have your best friend, best friend. I'm your best friend. You can have your best friend somewhere else, but I'm your best friend. But you can have your support team, but sometimes it takes someone from the outside that is showing you they care, because, from personal experience, I have a great support system, but sometimes I just need to talk to someone that was not biased, that wasn't like, oh, you're a great mom. No.
And a professional, they know what they're talking about.
Right. Yes. And I think a lot of moms struggle to, specifically when we're throwing in all these other things, they don't want to go talk to a therapist. They don't want to, but they're willing to talk to someone that isn't all high and mighty. Right. Like, hey, I'm just here to help you. Whatever you need. I'm not going to push medications on you. I'm not going to push all this stuff on you. What you want is what I will do. Right. Or I'm not going to threaten to put you in a hospital. Exactly. Right. And that, I think, is a huge concern for a lot of parents, is they don't want to ask for help because what's going to happen if I ask for help. So
yeah, that wound up happening with me. The facility that I went to had signs all over the place. If you're having the baby blues or anything, let us know, we can help you. And I was having postpartum psychosis, and I was like, hey, I don't know how to get this to stop. In the hospital, it was fine. They put me on a medicine that I had taken before for anxiety and depression, and it fixed it. And the facility was more like, oh, we really don't want you taking anything. And I'm like, I need this. Yeah. I'm seeing stuff, and they're like, oh, okay, where can your baby go? Because we're going to have to probably put you inpatient. And I was like, you will never hear from me again. Right.
Like that. And that's so unfortunate that a mom seeks help and then they're threatened with literally what the reason they're having and asking for help. Like, oh, I'm going to take it away from you. Right. No, you don't take my baby away from me. Right. No. So if there's any support that I can provide, again, I'm not a licensed therapist. If it's to the point that I think that's what you need, I will suggest it. Right. But where I can help, I'm more than happy to. Yeah. Well, that's really great.
So Darby, where can people find you if they want to look you up on social media or oh man,
Instagram or
yeah. So I actually do have an Instagram that is specifically for all things breastfeeding and lactation and speech related. So it's milk.and like the word and dot mumbles. Milk and mumbles.
Oh, that's cute.
So I admittedly haven't posted in a while, but
you've been a little busy between certifications and children.
Yes, just a tad. However, you can reach me through there. So if you have direct questions, you can DM me on that. I also have a Google Voice number on there that you can contact me through and text me anything that you need. And just some general questions. Eventually I will get back to posting tips once life slows down a little bit. But there are some things on there. this past winter, I posted some stuff for lactation during the 6th season. So things like that.
Oh, good.
That's
Good.
cool.
Yeah. So that would be the best place to contact me, or come to Donovan Rehab.
Awesome.
That's where I'm at too. Yes.
Well, we really appreciate having you
Yeah,
today, Darby. Thank you for joining
absolutely.
us. This has been extremely informative.
Yes.
And we got, well, almost toys. We got books this time
Yes.
and a tablet.
Yes, totally.
So we will see you next week. We'll have another guest, an occupational therapist next week. And we're so excited for our series on autism through the lifespan. We hope you have a great week. Remember, it can get better than this.
Thank you for joining us today. Next week, we will conclude our Autism Through the Lifespan season with an interview with occupational therapist Richard Glover. Remember, it can get better than this.
Bye-bye.
Bye.